Hey guys, so I wanted to make a video because had Ava. I had Ava on April 12th, and I haven't made a video in a while. I was gonna make a 39-week video, but I had her at I think 39 weeks and 3 days maybe. Um, so I'm just gonna make a quick update, and then I'll probably just do more in-depth one later, maybe. I I had stayed at my mom's house for a couple nights because I kind of thought something was going to happen and I'd rather be there because she was going to be the one that would drive me to the hospital and be my labor coach. So um, April 12th at 3:30 in the morning, um, it was weird. My water broke, but I woke up. I was sleeping in my mom's bed and I woke up like a minute before it broke. Not really sure why I woke up. It was weird, but Um, I woke up, my water broke, and I was really excited because finally something was happening. And so my mom and I got ready. I had my diaper bag, or the hospital bags in the car seat, already in the car because we had gone the day before because I thought I was going into labor. Um, so we got to the hospital around 4. I know that when your water breaks, usually they'll tell you to come in when your contractions are about 5 minutes apart. But because I tested positive for Group B strep, they needed to put me on antibiotics. So yeah, so because of that, they told me that as soon as my water broke, I needed to go in, even if I wasn't having contractions. So I was having contractions, but they were very irregular, and not overly painful. So we got there around 4. And then when they had tested my strain of GBS, the only two drugs that were good to go against that were penicillin and vancomycin. Unfortunately, I'm allergic to penicillin, so the only drug that was available for my strain was vancomycin, which unfortunately is the strongest drug used for that. It does burn going in your veins. I'm not sure if any of you have had this, but they put me on the IV drip for about an hour, or what was planned to be an hour, and it burned going in. First of all, I don't know if you can see this bruise. It's probably not that noticeable on here. And then I have another bruise here, but it took about 4 nurses over the span of an hour and a half, 2 hours, to get the IV in. I wasn't dehydrated, so I'm not sure why it took so long. But usually they only put a needle in up here if, or that's usually, they leave that area open because if the IV team needs to go in and draw blood, that's where they do it from because it's an easy accessible vein usually. And they could have done it through the hand, but the veins in your hand are all kind of small and more delicate, so for a drug like vancomycin to go through those veins, it would be too harsh just because it burns and it's so strong. So they tried a million times in my arms, and it was excruciating, especially the one that I had this bruise from. Um, and so eventually they got the vancomycin in. I guess I'm just going to make this my labor story because I'm kind of going into detail. Um, they got the vancomycin in about half an hour in because it was going to be over the span of an hour. I was laying there and my scalp started itching, and I thought, well, maybe it's just dandruff or something. But the itchiness got absolutely unbearable. I have never experienced anything like this. Um, I honestly felt like my head was on fire. I tried putting a cold cloth on my head and like wringing water onto my scalp to relieve it, but it was so unbearably itchy. I wanted to rip my hair out. It was very uncomfortable. It lasted for a while. I got the nurse in there. They decided to lower the, or sorry, they decided to lengthen the time of the drip. So instead of an hour, it would be over the span of 4 hours to make it less intense. And the itchiness did eventually go away, but it was extremely uncomfortable. I was having really bad chest pressure and pain, and I was afraid that it was an allergic reaction and I was going to stop breathing or something. But I'm pretty sure it was just from my anxiety. So eventually that went away after a couple hours. So they gave me that, and I was having contractions, but they were irregular. And they decided to send me into another room to induce me. Um, they put me on oxytocin, and it was just a very long, long day of a nightmare. Um, I was on oxytocin at 10:20 in the morning, and I was on it for 9 hours. Um, Usually, I'm not sure of the units if it's milliliters or what, but usually they can go up to 30, and at the end of 9 hours, I had only gotten to 6. Um, so they put me on it. They started at like a 2 or something, and then my contractions. What happened was my contractions were never regular. They were one on top of another with no resting periods, and then I would go 10, 15 minutes with no contraction, and then a strong one, and then a whole bunch of irregular contractions, one on top of another again, which was painful because I never got a rest. So, I mean, the contractions were overly painful, but at one point, they were getting painful enough for me to have to breathe through them. Um, but the constant contraction, one on top of another, was not a good time because it just felt like I never got a rest. My stomach was in a constant state of contraction. Um, so over the span, just 1 second, I'm just gonna check something. Okay, so over the span of I look horrible, but I don't. I don't even care. Over the span of 9 hours, instead of going up to potentially 30, I had only gotten to 6. It was very frustrating. I would go up to 2. My contractions would be very irregular. They'd drop me down to 1. And then after 2 hours, they'd bring me up to 3. And then they would be irregular again, and they'd bring me down to 2. And so it was up and down all day. My body was resistant and um, sensitive and just didn't want to take it. Didn't want to go into labor naturally. Didn't want to go into labor induced. Um, Probably the most depressing part about there was a lot of depressing parts, but the really frustrating part was at 12, they checked me. My cervix was still 1 to 2 centimeters dilated, as it's been for ages, since I was like 34 weeks. Um, it's still the same amount of face, and the baby was high up apparently, which is confusing because on my last ultrasound they said her head was against my cervix. Even my doctor said that she was low, but when they checked me, they said that she was too high up. Um, so they checked me at 12, and that's what had happened at 12. Not much. And then after hours of pain and irregular contractions and back pain and just stress, they checked me again after 9 hours, and I was still the same. I hadn't dilated, I hadn't effaced more, she hadn't moved. I cannot tell you how depressing this was because after that long of being on something like that, thinking, this is oxytocin, it's going to get things rolling, absolutely nothing had progressed. In the span of the 9 hours, her heart rate had dropped a few times, and one of the times it was the most terrifying experience of my life. Um, Her heart rate dropped from baby's heart rates usually are between 110 and 160. Hers is usually about 150 on an average. Her heart rate dropped from about 150, 160 to about 88. And that was the scariest thing I have ever experienced in my life. I could hear her heart rate going down on the monitor. I saw it. Within 2 seconds, there were like 7 to 8 people in there. They had me flipping from side to side to see if they could relieve, maybe she was laying on her cord. It took a bit, it took a while to get it back up. They had put oxygen on my face. No one was really saying anything because I know they kind of go into a zone. Um, it was absolutely terrifying, just so scary. And after that happened, that was like at 12. Um, and so, of course, as you can imagine, I'm laying there all for the rest of the duration of on the oxytocin, staring at the monitor, being paranoid of any time her heart rate drops even just a little bit. I know that their heart rate can drop periodically throughout labor, which is normal, but not when it stays down and it's hard to get back up. So that was really scary, and I was just in a huge amount of stress the whole time. Um, so basically, because nothing was progressing, because my body didn't really want this to happen, and also because of the fact that I was GBS positive, which, after your water has broken, I don't know what the set time is, but they really don't want to prolong the time that you're in labor when you're GBS positive in case you transmit something to the baby. Even if you're on antibiotics, I mean, it's just not the safest, I guess. So basically, they came in at whatever time it was during the night, and said that pretty much my option was a C-section and that it was going to be done in about 45 minutes. So at that point, I really didn't care. I wanted the C-section. I wanted her out. I didn't want her heart rate to drop anymore. I didn't want any more stress. And I had my mom in the delivery room with me. Not gonna lie, the C-section was another one of the scariest moments of my life. Part of that might have to do with the fact that I have a lung infection. So because my diaphragm was frozen, anytime I coughed, I couldn't use my diaphragm. So I was just basically using my throat, and it felt like I was gonna choke. Um, Coupled with the fact that I have anxiety and I was having a really hard time dealing with the C-section being frozen. It was just the whole time I was there. It was just one thing after another, and very very scary. The C-section lasted about 10 minutes. She was born at 10:35 p.m. on April 12th. She was 7 pounds 10 ounces, so that was kind of a shock. I was expecting her to be a lot bigger. She was 20 or 21 inches long. I have to double check that. She has very little hair. It's really cute and bright blue eyes, but I know that they change, or they can change. Um, just trying to think. It's the 20th today, so I was in the hospital until the 16th. So I was discharged on my due date actually, um, and it's taken a while to get used to it. I'm still getting used to it. Lots of sleep deprivation. There was probably about the first 6, 7 days. Um, I was getting 2 hours of sleep a night, which is making it very difficult. But I mean, it's all completely worth it. It's just very tiring. Trying to get used to the breastfeeding and all that. But I'm gonna quickly show you Ava. She's sleeping right now. Her name's Ava Jean Baldwin, and she's a very good baby. She doesn't really cry. When she does, it's more of a whimper, and it's only really when I'm changing her diaper or she's starving. But I'm trying to get used to the breastfeeding. It was hard to get her to latch and whatnot, but I'm getting used to it. So I'll show you Ava and what she looks like. It's going to be kind of hard because I'm using my laptop, but I'll just show you. Here she is. It's kind of hard to show. Yeah, so that's Ava, and I don't seem very excited in this video, but it's just because I'm absolutely exhausted. So I'll be making more videos. I'm going to make a nursery video because I've started to set it up, and her crib is getting delivered on the 26th of April. So yeah, I will be making some more videos, and thank you guys so much for watching all my videos throughout my pregnancy. It's really hard to believe it's over already. Feels like it lasted forever, but at the same time it feels like I just found out I was pregnant yesterday, so it's hard to believe. But yeah, thank you guys so much for watching, and I will see you guys in a video in the near future. Bye!